This patient aged about 50 years, Mr. Surya Narayana Reddy, needs a full mouth rehabilitation. So this is the OPG of the patient. Let's discuss about a few landmarks which are important before placing the implants. So this is the tuberosity area on both the sides. Tuberosity. This is the nasal floor. This is the anterior nasal floor of the maxilla. And look at the mandible. So good bone here, good cortical bone, you can see. And you can see the mandibular canal here, that is the superior border and the inferior border of the mandibular canal. Here also you can see the superior border and inferior border of the mandibular canal. So here the bone is good, the cortical bone. Here also in the nasal floor the bone is good. So you can place the implants from canine to canine, here also from canine to canine. First choice is BCS, or otherwise I place compressive implants also. So here in the tuberosity, through the tuberosity in the posterior wall of the maxillary sinus, through the posterior wall of the maxillary sinus, you can place tuberopterygoid implant. So, or if you plan through the root, the distal root of the second molar, you can place the implant into the pterygopalatine fossas. That is, the implant will go and engage in the area between the medial and lateral pterygoid. So it comes here, this region. Here also it comes here, this region, pterygopalatine fossa. There we have to engage our implants. You can place BCS or compressive also. So here in the nasal floor, you have to hit the nasal floor, perforate the nasal floor and place your BCS or compressive implants. Here in the nasal floor, in the tuberosity, and engaging into the pterygopalatine fossa, you get good engagement, good stability and anchorage of the implant. In the lower, you can place 3.5 or 4.5 also dia length. Here in this case, it's I think 25 total. You can place 23 mm. So you can engage into the cortical bone. This is the cortices. So good bone is available. You can engage here. So beyond the root apex of the tooth, so this area you can engage the bone. You can see the mental foramen here. This is the mental foramen, you can see here. So here in this area you have to be careful, or otherwise what you are supposed to do, you have to bypass this area if you want to place the implant here. Otherwise you can place it straight also if the bone is good, or if there is an atrophy you have to bypass this area, bypass the implant in this region. So careful with the mental foramen while placing the implant. This is the mandibular canal. There is a superior border and inferior border. This is the superior border and inferior border of the mandibular canal. So in the mandible, careful about the mandibular canal. Okay. Usually in full mouth cases, upper between canine to canine, 6 implants. So engaging into the pterygoids, 2 in the pterygoid region on both the sides. So double pterygoids, so totally it will be 10. In the lower, anterior from canine to canine, you can place 6 in the molar region, premolar region 1 and molar region 1, premolar region 1. And then the molar region 1. So it will be total 8 here, 10 here, so total 18 implants. If needed, you can place 10 in the lower also. So between 18 to 20 implants needed in full mouth rehabilitation case. So let us talk about this tuberosity area. So you get good engagement. There's a good bone here in tuberosity on both the sides. You can place tuberopterygoid. I prefer placing here BCS or otherwise BECS X implants. It will have different design. It engages well. So anteriorly, I prefer BCS. Lower also BCS. So here in this area, in the molar area, in the floor of the maxillary sinus, where the bone is less, you can go for 6 or 8 mm length BCS or compressive. So dia will be same. I think 8 mm, or the dia will be around 5 or 5.5 mm. Okay, here also you can place. So usually in this case 6 or 8 mm length. So dia may be 4.5 or 5 that you can place here. You can place. So this is the overall picture. So you need to evaluate before starting your case. So as you all know, corticobasal implantology is minimally invasive. Without opening the flap, without giving much discomfort to the patient, we can place the implants and give good processes also. Thank you.